Thank you so much for talking to us this morning.
Pleasure.
The NICE is pretty much a middleman really between new scientific research and the NHS and getting new treatments into to patients really. Could you just describe the process and how that works a little bit?
In producing guidelines?
Yeah.
Yes,
sort
clinical
of get
guidelines, yes.
Yeah.
What happens is we are asked to do a guideline on a particular area. We're commissioned, as it were, by the Department of Health. And the first thing we do is to what we call scope the guideline. And we work out what the scope is going to be. So if it's on breast cancer, is it going to be on prevention, early diagnosis, treatment, late treatment, and so on. The second thing we do is we get together a guideline development group. Broadly made up of people, doctors, nurses. Some of them are specialists, some of them are generalists. It's quite important to have generalists as well as the specialists around. And we also always have two patients, or service users, as they prefer to be called. If we're doing a children's guideline, then we have parents of children with the sort of particular problem. So, for example, the very first guideline we did on schizophrenia, we had two people who had schizophrenia who were better, and they contribute a huge amount to the whole process. The guideline development group then, having got the scope, then works out the questions the guideline needs to answer. And for each question, a systematic review of the relevant literature is gone through. And that can be massive. We did a guideline on lung cancer and 64,000 references. So they're big pieces of work. They're not done in a couple of weeks. They take overall about 18 months. The guideline group meet every month. They go through all the evidence and they develop recommendations for the pathway of care, which might be schizophrenia, it might be antenatal care. And then they produce a draft version, which they send to all the stakeholders, the people with an interest, manufacturers, patient groups, professional groups. And then they look at the comments very carefully. The comments, sometimes we have over 1,000, 1,500 comments on the guideline. The guideline development group then have to go over the comments, and we require them to explain why they are rejecting it or why they're accepting it, because people come up with better ideas. And then the guideline is published. So that's basically the process.
That's great, thank you. So is there ever any scope for public demand or the general population or the media to get involved in the guideline process, or how do you?
Well, not in the process, no. The media may comment on a draft guideline because they see the draft like the stakeholders, all the other stakeholders do. And if people from the public or the media have comments that are useful, then we would incorporate them. But it's mainly the professional patient organisations, manufacturers' comments that are the most important.
Okay, that's great. So we can all think of stories that have been hyped by the media, so MMR and swine flu and things like that. How does the NICE as an organisation respond to the big furore that might challenge guidelines that probably don't need alteration?
Well, curiously enough, the guidelines themselves are relatively rarely challenged. I mean, they are criticised sometimes. We did a guideline on head injury, and we said just doing ordinary plain sky X-rays is useless, basically.
Yeah.
And if you really want to look at somebody's head, you've got to do a CT scan. There was a bit of a criticism. People said, well, we haven't got enough CT scanners. And 3 years later, it's all happened. And despite all those sort of initial criticisms, it's all happened.
I suppose that happens quite a lot, really, doesn't it?
Yes, so we did another guideline on depression, and we said in mild depression, probably cognitive behavioural therapy, talking therapies are better than the drugs. People said, oh, there aren't enough clinical psychologists around. Actually, the government put in place a whole mechanism for increasing the number of clinical psychologists in the health service.
Has that happened then?
It's happening now, yes.
Yeah,
I mean, they put
fantastic.
Huge sums of money in. Yes. Yeah. So sometimes what we're saying is it may not be standard practice all over the place, which is the whole point of doing a guideline, but it does stimulate developments and investment in new things, new bits of equipment, more CT scanners, or people like clinical psychologists.
That's great, thank you. And finally, I just wanted to move on to ask you a bit about the politics behind the NHS and how NICE deals with that, because obviously the NHS is a governmental body.
Yep.
And is NICE as an organisation ever asked to compromise or sort of go against scientific research in favour of political?
No, it wouldn't work. It just wouldn't work, because all our guidance is produced by, not by me or my board, it's produced by people from the health service. And if I ever went along to them and said, please, 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 I've just had Mr. Lansley on the phone, he wants you to say this or wants you to say that, it wouldn't work. They'd walk out and they would hold a press conference outside the building and blow us sky high. And actually, to be fair, we've never had politicians pressing us to do things, to go certain directions.
Do you think that's because it would have that sort of response to it?
Well, yes. I think partly that. Partly, I think politicians also actually don't want. They want to know what the best science says and act accordingly.
Yeah, that's fantastic.
Okay.
Thanks very much. Brilliant.